In the Know, a radio program talking to the newsmakers in Ogle, Lee, DeKalb counties and beyond, keeping you in the know. Here's your host, Charles Van Horn.
Good morning, and joining us today is Abby Hoskins, the Regional Council Manager for Region 47 of Birth to 5, Illinois. Good morning.
Good morning. How are you?
Doing great. Glad to have you with us talking about child care and child education and early childhood services. First off, Birth to 5 Illinois, sort of self-explanatory about the demographic you cover, but what exactly is it Birth to 5 Illinois does?
Yeah, thanks for asking. So Birth to 5 Illinois works in every community in the state to continually assess the early childhood programs available in each region. Also to understand what's available versus what local families say their children need. And then also to bring together community members and civic leaders to bridge the gap between what exists and what families need. So our region, which is Region 47, serves Lee, Ogle, and Whiteside counties.
That is an awfully big area. When I talk to a lot of these regional organizations, they've all been consolidated and taking on more territory than they can handle at times. That is a lot of kids that need services in that demographic. Do you have any idea on statistics as to how many children birth to 5 are in need of early childhood services or child care programs?
Yeah, so in our region, some of our data, which is a couple years out of date at this point, but from our original needs assessment, we had found that just over 8,000 children, 0 to age 5, are in Lee, Ogle, and Whiteside counties. Specifically looking at needs is why we really work with the community to hear from them, because we know every family is a little bit different. We know, for example, for childcare, about 32% of our kids can get a licensed childcare spot if they want it. So obviously that depends if the family wants it and needs it, but that's obviously a big percentage that's not available to them, and we call that a childcare slot gap. So that means that there's a gap in the number of kids versus the number of spots that are available. We also have a lot of other early childhood programs beyond childcare, so Head Start, Preschool for All programs in our schools and the Regional Office of Education, along with private-based preschools such as churches and things like that as well.
That is a lot of children sort of missing out. And you mentioned how families are stepping up. Obviously, grandparents, things like that, stay-at-home parents, obviously help in meeting the needs for some families, but that's not available to everybody. And with childcare programs tough to get kids into, the economic impact is massive if you have to always hire a babysitter or you have to take the child a great distance to get into a program that's maybe further away from home, or worse, you have to not get any outside child care and stay home with the child to being able to enter the workforce. Like, the economic impact of these struggles is real to many residents in the area.
Yeah, it definitely is. We've heard a lot about transportation being one of the top things for our region. So just like you said, families are driving typically on average around a half an hour for childcare. And then it also does have an economic impact, which I think is great that you bring up. So we are a backbone agency that works with the community. And by working with the community, we get to hear from everyone. So we're working with the folks that are in early childhood, like childcare and Head Start and the Regional Office of Education. We're also working with mental health and social service agencies, but we're also working with the businesses and faith leaders, chambers of commerce, law enforcement, and elected officials. And by having that kind of cross-sector group come together, we really get to hear all those different voices and hear those impacts and really look at how can we all work together to make some solutions that work for our actual region.
Your agency recently released a report about some of the concerns and needs in the area. Tell us a little bit about that report, how long it took to put together, and what are some of the findings?
Yeah, so thank you for asking. So our team and our council, so like I talked about, we work with an action council, which were those cross-sector community leaders. And then we also work with a family council, which is the best part. It's families that are living in Lee, Ogle, and Whiteside counties, raising children under the age of 8. And then we're also really fortunate to partner with the Sauk Valley Stars Early Childhood Coalition that's chaired through the Regional Office of Education. So these two councils and the STARS Coalition came together with us, and this report happened over the last year, but we're really excited to share our new Changes in Early Childhood report with the community. So when Birth to 5 Illinois began, we completed our first early childhood needs assessment in 2023. So it's been a few years. We wanted to take another look at how things have changed. This report uses community feedback to provide context to available data, and it also highlights the changes in our region that have happened since 2023. The report also celebrates progress that's been made on our action plan. So I think it was about a year ago I was on the radio station with you sharing about the OWL Early Childhood Resource Hub and the Child Care Toolkit that's been developed with our councils and our communities. If you haven't been able to check that out yet, go to bit.ly/m/OWL Early Childhood. And that's an example of the progress that was made on that first needs assessment. But most importantly, the report identifies our region's current strengths and opportunities. So that way we can continue to work together to support young children and families in Lee, Ogle, and Whiteside counties. It looks at our strengths and needs. So looking back where we were in 2023, we found that some of our region's strengths and needs are still the same. But then we also, while working with our councils, identified a few new priorities.
One of the priorities you pointed out is the statistics about child care programs that have closed. And those numbers seem kind of frightening. And is there any reason why these programs were closing? Was it lack of funding or retiring or lack of a location? Like, what are the reasons why child care programs are becoming scarce?
Yeah, so when it comes to strengths, I guess starting with that, we heard great things about our program. So I think it's important to highlight that. We heard that from different parents. We heard it from providers, that we do have high-quality early childhood programs for families, but it's the ones that are able to access them. So you kind of hit on that of we just don't have enough of them. When we talked about the needs, a lot of it related back to needing a stronger workforce. So that recruitment and retention piece is really what we heard from the community. We continue to see challenges with recruiting early childhood professionals and also retaining them. We heard from a lot of providers that hinges on them opening additional classrooms if they're a center-based childcare program, for example. So we're really looking at how do we work to strengthen that workforce and support them so that way we can open more spots in our region as well. We did hear about financial struggles from those programs, but we also know logically that kind of goes together. If a program doesn't have all of their classrooms open, then financially they're probably not going to be in the position that they want to be. So we really have been talking about that as councils of what can we do to really help this stronger workforce.
What do you think, if you could wave a magic wand, what would it take to get the region to full strength? Like how many daycare slots would need or childcare slots would need to open up in the 3-county area you cover to meet the demand?
Yeah, so we hear a little bit of a different, story from everyone we talk to. So some areas are doing well, and they're looking to fill some spots with kids. And that tends to be kind of more in our what we would consider in our region, our larger cities. So like Rochelle and Dixon and the Sterling area. But then there's also some centers that are still working to improve that. So I guess there isn't really a magical answer for that. We also heard that our rural areas, so we've talked to folks in Polo, for example, where they aren't right next door to Dixon. They can't just hop over there. So they're having either to travel to different places or really stay on a wait list for a spot. So if we're looking at about a 32% availability, definitely if we want to start taking some baby steps and increase that. But like I said, working on improving that early childhood workforce is what we really heard from the community as that first step, to answer your question.
Shifting gears slightly, let's talk about some of the things that are on the periphery, I guess, of Birth to 5 Illinois. You talked a bit in the report about mental and behavioral health support, which is obviously big for young children because that is when parents will reach out and maybe seek a diagnosis or try to see if there's some developmental issues with children. How does Birth to 5 help that, and what did your report uncover?
Yeah, so we actually worked over the last year on an action plan step related to mental health. And that also involves kind of like developmental therapy, so early intervention, speech therapy, developmental therapy, occupational therapy. And one thing that our councils found was that we need to make sure we're having really good cross communication. So that involves families, that involves our early childhood and mental health group, and then also healthcare. So we've been working over the last year to just kind of bridge any gaps that exist and make sure that this OWL Early Childhood Resource Hub was shared with our healthcare community. So then that way, if a parent is going to their physician or healthcare provider, then they're getting it from them. And then also, if they're talking to their childcare provider, they're getting those resources. So then they know where to go for what's available in our region. As far as the report, in our Changes in Early Childhood report, mental health and developmental therapies are another area that we know support is needed. So families and providers have shared that it can be difficult to find services or understand what resources are available, how to navigate referrals, and this is especially for young children. So really looking at that 5 and under age group specifically. Many dedicated organizations in our region are doing great work, and we want to make those connections easier. So our Action and our Family Council and the STARS Coalition have actually already started working on new action steps. And one of the goals that we're working on is creating an early childhood roadmap that can be used in addition to the OWL Early Childhood Resource Hub. And the hopes is that that can continue to strengthen partnerships across healthcare, mental health, and early childhood so families can find the support that they need more easily.
Abby, one important thing, you keep talking about that OWL Hub and the resources that are there. Even if you don't have a child under the age of 8, are there still resources there to use to help guide you through some of the programs and support that's available throughout Northern Illinois?
Yeah, so OWL, which is Ogle, Whiteside, and Lee for the acronym, is really looking at so many different great things, and that's how we explain it to families. Even if you don't need the resources right now, there's just fun, family-friendly events going on in our region. So whether it was the event that was hosted in Rochelle by 4C last month or an event at the library, a family can go on there. But then if they are needing resources, they can look on there for our child care toolkit. So how to get connected with 4C, our child care resource and referral agency, and get supports with help paying for child care, help finding child care. If they are concerned about their child's development, they can go on there to be connected with early intervention and be able to work on a referral with them. The whole OWL site also connects to our Regional Office of Education in Sterling, which covers the 3 counties as well, has a coordinated intake specialist. So if they click the OWL at any point throughout the whole site, they can be connected with a live person to find the resources. And whether that is something developmental, whether it's getting a screening for preschool, or whether it's food insecurities and housing, they'll connect them with our region's integrated referral system, IRIS, and be able to connect them with who is the best fit person or agency to support that family. So it really is a really well-rounded system that will connect them. And then even if they're right around 8, the Regional Office of Education obviously serves all those ages, so they'll help them out and get them to the right people.
Abby Hoskins, Regional Council Manager for Region 47, Birth to 5, Illinois. Thank you so much for joining us today.
Thank you for having me.
Thank you for listening to this week's In the Know. The program returns next week at this time with another great conversation with someone from your community.